Good afternoon, everybody. We are starting question and answer section, and this session is for all those who are, with us on server. When I say server, I mean for online server-based courses. We are getting regular, questions for this interactive sessions, and we are compiling these questions. And we are taking these types of interactive sessions at regular intervals. So first of all, please make a note that this is not a course, a class right now what we are taking, but we are taking purely question and answer session for those who are registered with us for different server-based courses. So first of all, I will show you the list of questions what we got today for discussion. So this is the list of questions. The first question here is from one of our candidate, that is Dr. Bhumika, and the question says, needs to ask, sir, about my difficulty in getting the CBD while doing upper abdomen ultrasound. Now, the language is original. I mean, whatever we got the question, the way we got the question, we just copied and pasted it over here. So the question, actually, I'm elaborating the question. Question is how to get a CBD, good CBD, where from to get a good CBD, and that is from Dr. Amit. Dr. Savita is posting the question regarding the propagation speed of sound, why it is less in air and more in bone. And the second question is that why there is more of attenuation in air than bones. This is the question from Dr. Savita. And the third question is that the number of pulses in 1 second is pulse repetitive frequency. Is it so? So I'm reading the question, I'm elaborating the question actually. So these are the questions posted by Dr. Savita. Dr. Ashok is posting how to confirm an omphalocele from ultrasound. I already told you that the language is original. We just copied and pasted the questions over here. So the question actually is how to make a diagnosis of omphalocele and gastroschisis, how to differentiate it. Now, the next question from Dr. Kalavian, and she is probably from Malaysia, is posting the question that I want to ask about the gallbladder since I just started. What are the important major bits? So the question here is that what we have to see in the gallbladder, I mean the measurement part. So please don't draw on the screen. So Anna, please remove this annotation, okay? Now the next question from Dr. Pooja. Is actually she is sending us a picture of a cord round neck, and she wants to confirm whether this is a cord round neck or not. I will show you the picture, whatever we have got from Dr. Pooja. And the next question from Dr. Rossi is that regarding the ovarian location. So I will elaborate this question and I will take this. So Dr. Savita next is posting regarding the cervix. What is the actual measurement of the cervix, whether it is 2.5 or 3, and regarding the scar thickness also. Now, Dr. Lopa Das is posting the question regarding the cardiac pulsations of the fetus and regarding the molar pregnancy and the intrauterine pregnancy, how much ahead is that? So these are the list of questions of what we got today from our candidates. I will take first question first. First question, I am having a printout of these questions over here. So the first question is from Dr. Amit, is that how to get a CBD. So first of all, please go through the course properly. There is a practical session in abdominal ultrasound where we showed you in detail how to take a CBD, where from to take a CBD. Okay, so let me share the screen first now. Okay. Now see, when we say CBD, first of all, there is a Mickey Mouse sign. there is a Mickey Mouse sign. Now, in this Mickey Mouse, there is a face, there is this left ear and a right ear. So these are the two ears, and this is the face of the Mickey. Now, what actually I mean by that, this face of the Mickey is the portal vein. So you will see on ultrasound like the Mickey Mouse sign over here. This is the face of the Mickey. So when I say face, it is actually the portal vein, and one ear of the Mickey is the common bile duct, and another ear is the hepatic artery. So you have to first attempt to see this Mickey Mouse sign on ultrasound. Straight away, you may not get a common bile duct, but you have to first take this Mickey Mouse sign at the porta hepatis. Once you saw this Mickey Mouse sign, then you know that this ear is the hepatic artery, and this is the common bile duct. When you will put a color box over here, what do you think? Which part of this Mickey Mouse will take color? Of course, this portal vein will take color, hepatic artery will take color, and this common bile duct will not take color, confirming you that you are actually cross-cutting a common bile duct. So then, without leaving this common bile duct in this transverse section, take the longitudinal section from here only. And if you lost that, go back to this Mickey Mouse side and try to take the longitudinal section of this common bile duct from here only. So this is the way how you can take the common bile duct. Now again, requesting you to go through the practical session on your server, where we have in detail shown this on many patients, not actually one patient. Now the next question from Dr. Savita. Now Dr. Savita is posting a question. Now see, I am reading the question. You first try to understand the question, because Dr. Savita is well aware of the question. I want you to understand the question first. The question is, why the propagation speed of sound is less in ear and more in bone? Okay, I'm repeating the question. Why the propagation speed of sound is less in ear and more in bone? Can anybody tell me in the chat box over here? There is a comment box. You can see the more option over here. When you will click on the more option, a pop-up will appear over here, the chat one. So you can please chat over there why the propagation speed of sound is less in ear than in a bone. Dr. Richita is posting that it is a bad conductor. No. Listen to the question. When I say sound, propagation of sound, I mean actually the ultrasound, because sound and ultrasound are same. We have discussed that in the physics and machine settings course. The question reads, why the speed of the sound is more in bone than in ear? Yes, Dr. Sudha Singh is posting more of density. You got it right. So it is because of the density, it is because of the stiffness of the bone that the sound is traveling more as compared to the ear. Now, the second part of the question, not the part, the second question is, in scan bone, the language is from the doctor who is posting the question. In scan, bone cause maximum shadowing. Listen to question first. Repeating the question. In ultrasound scan, bone cause maximum shadowing. Still, we say attenuation in ear is more than bone. Now, I'm elaborating the question. She is saying that the attenuation of ultrasound is more in ear than bone. Is she right or wrong? You just type yes or no. I'm repeating the question. Is attenuation more in bones? Is attenuation more in ear than bones? Yes or no? Repeating the question. Is attenuation more in ear than in bones? Yes or no? Now I got one no, two no's, three. Dr. Sudha, yes, no. And I am getting many no's. So actually, Dr. Savita, you are understanding this wrong. Everybody is posting here no. It means that the attenuation has to be more in bones than in ear. Okay. So, third question from Dr. Savita. number of pulses in 1 second is PRF. Repeating the question. Number of pulses in 1 second is PRF. Is she getting it right or wrong? Is this right or wrong? Repeating the question for last time. Number of pulses in 1 second is PRF. Yes or no? So one no, one wrong, second wrong. Dr. Sudha wrong, saying wrong. Dr. Rajesh Kumar saying wrong. Next. Dr. Ruchita saying wrong. And I am getting wrongs, money wrong. So it is not the number of pulses which will be labeled as PRF. Now, what is a PRF? Dr. Sarita and others who may get confused in this, number of pulses in 1 second is not pulse repetitive frequency. Now, putting the question in another way from my side, what is number of pulses in 1 second? If I say number of pulses in 1 second, what actually I am quoting? What is that? What is that called? Number of pulses in 1 second. In our chat boxes now. Frequency. One with frequency. Second. Dr. Sarita, Dr. Kirti. Yes, frequency. I am getting many frequencies. Thank you. So the number of pulses in 1 second is not the PRF. That is actually the frequency. Now, what is a PRF? In your comment boxes now, what is PRF? This will revise the things. What is PRF? What is the full form of PRF? In your comment boxes now, fast. What is PRF? In your comment boxes, chat now. Dr. Sapling, no. Dr. Mustaq, wrong. What is PRF? What is the full form of PRF? If you know the full form of PRF, you will understand what is PRF then. Yes, pulse repetitive frequency. I am getting comments. It is pulse repetitive frequency. Dr. Mustaq, yes, now you got it right. Pulse repetitive frequency. Dr. Kirti, thank you very much. Pulse repetitive frequency. So, PRF is actually the pulse repetitive frequency. Okay, so Dr. Savita is actually confusing the frequency with PRF. PRF is pulse repetitive frequency. How frequently the pulse is being repeated over a given time. That is PRF, pulse repetitive frequency. Okay, so these were the questions from Dr. Savita which we have discussed. Now, Dr. Ashok Kumar from Nepal is posting how to confirm omphalocele and gastroschisis from on USG. Dr. Ashok Kumar, if you are online right now, please raise your hand. I will directly, unmute your system and I will discuss that with you, this topic with you. By raising the hand, not this physical hand. In more option, there is the option to raise the hand. Please raise your hand now if you are online. Dr. Ashok Kumar Yadav from Nepal. If you are online, please raise your hand. Now, probably he is not online. Yeah, he is not online probably. Now, why I wanted to unmute him? Because I am very much sure that that person has not completed, not even touched the abdominal, fetal abdominal ultrasound, because there is a big, there are approx 4 to 5 classes on this gastroschisis and omphalocele. What is the point? The point is, please post your questions from the topic. What you have not, you have completed or even you have started, because this is not a course right now what we are conducting. This is a question and answer session. So anyhow, as I have got this question, I have to, go for a brief of this. Now, when I say omphalocele actually, is this shared? No? No? Okay, I'm sharing. Got it? Yes, Anand? So when I say omphalocele, I have shared it. See, what is the issue? Why it is not showing? Okay, when I say omphalocele is actually a central defect and gastroschisis is the periumbilical defect. So if it is more in center, then that is omphalocele, and if it is away from the center, not this. Yeah, for that one. Mhm. So you have to see whether I am dealing with a central defect or a periumbilical defect over there. So hold on, there is some technical glitch. Is it shared? So in omphalocele, there are more of chromosomal abnormalities as compared to gastroschisis. It means that if I am seeing a gastroschisis, I will say, thank God, I am dealing with a gastroschisis as compared to the omphalocele, which are more dangerous because I am having a high level of chromosomal abnormalities over there. In omphalocele, there is a membrane. So there is a membrane which is covering the defect, whereas the gastroschisis is an open defect. So the point here is that we can differentiate omphalocele from the gastroschisis by the look it is, by the location. So I will again request you to go to the course and complete the course first and then post the question. Okay. Okay, next question. Am I audible, Anna? One knee. So Dr. Kalavani from Malaysia is posting, I want to ask about the gallbladder scan since I have just started. So what are the important measurements we need to take, like the length of the gallbladder width? I have to stop it. Okay, now coming to the gallbladder. Gallbladder. In this gallbladder, what we have to see is the length and the width. So here the length is approx as it is about a 7 to 8 centimeters long, and in diameter it is 3 to 4 centimeters in diameter. So diameter you can take in a transverse section, and in longitudinal section you can take the length. And when I say the gallbladder wall has to be less than 3 millimeters. So less than 3 millimeters should be the gallbladder wall. So these are the important measurements what you have to see. And if you are dealing with an overdistended bladder, gallbladder, you will have more of length and more of diameter. And if you have an edematous or an inflamed gallbladder, then you will be having more of the gallbladder wall thickness. And the detail of the polycystitis and the edematous gallbladder, including all pathologies, is available on our server. Please complete the topic. You will get all answers of your questions. Now, Dr. Pooja is sending us a picture. Let me show the picture. This is the picture. Now, Dr. Pooja is sending us a picture of the neck. This is the neck. Is this a cord round neck? In your comment boxes, please tell me yes or no. This is the transverse section through the neck, and this is the cord which is over here. Is this a cord round neck? Yes or no? Dr. Pinky is posting yes. Next, is this a cord round neck? Yes or no? Hurry up. In your chat boxes, please comment yes or no. Okay, Dr. Sudha Singh, yes, and I am getting yeses. So yes, this is a cord round neck. Now the point is, I am having a good cord over here and good cord on this. So on sides, I am having good cord over here, but on the top it is very less, and in the bottom it is almost absent. Why I am not getting a cord round neck like a cord round neck? Okay, it has to be all through the neck if it is cord round neck. The question from my side is that why it is very less seen on the top and why very almost not seen in the bottom. In your comment boxes now. Because of angle of insulation. Dr. Shikha, thank you. Yes, this is because of the hitting angle that you will be missing the cord from the top and in the bottom. So yes, Dr. Pooja, this is called round neck. And she's posting whether this is a single or a double loop of the cord. So visually, it is looking like a single cord round neck. Now I am posting one more question. How to make sure that this is a loose loop of cord or a tight loop of cord? What we have to do in your comment boxes now. Hurry up. What I have to do to see whether this cord round neck is a tight or a loose loop of the cord? In your comment boxes now. Please hurry up. What can I do? Repeating for the last time. What can I do to confirm whether, Dr. Sudha, not just tight. Listen to question first. What I have to do to confirm whether I am dealing with a tight or a loose loop of the cord? In your comment boxes now, please hurry up. Over. Hurry up, hurry up, hurry up. What I have to do to confirm whether this is a loose or a tight loop of the cord? Whosoever has completed the color Doppler, there is a class in which we have taught how you can confirm whether this is, yes, Dr. Thomas, notch in the wave. Dr. Thomas is posting notch in the wave. Yes, if I am having a notch, when I say notch, where? In umbilical artery. In umbilical artery, normally we don't have a notch. And if I am having a notch in the umbilical artery, it means that I am dealing with the tight loop. Thank you, Dr. Thomas. So this is the point, how you can confirm whether this is a loose or a tight. So Dr. Pooja, your questions have we have discussed and given answer to your questions. Now, Dr. Roshi. Dr. Roshi is posting the question, since the ovary is not having a fixed location in extreme obese patients, by looking into the internal iliac vessels, we will invariably find the ovary. In case of long or broad ligament, will ovary always be found on the iliac vessels? No, it is not like that. Ovary does not have a fixed location. Ovary does not have a fixed location. So you will not always see with the iliac vessels. That is why you have to search for the ovary. Okay. Now, next question from Dr. Savita, right? Dr. Savita is posting about the the cervix. Short cervix is 2.5 or 3 centimeters. In your comment boxes now, what are the measurements to label any cervix for short, whether this is 2.5 or 3 on TVS? In your comment boxes now, is it 2.5 or 3 centimeters? So this cervix, when you will measure it on TVS to label as a short cervix, is it 2.5? Dr. Priyanka, Dr. Thomas, very good. 2.5, 2.5. So it is not actually 3, it is 2.5 only. Now the next question, part of the question, not the second question from Dr. Savita, is that, sir, how to measure a scar thickness in post LSCS patient? Bladder wall is to be excluded from it, yes or no? Yes, bladder wall has to be excluded when you are taking a this scar thickness. Next question, can we see palate of the fetus also to rule out cluster? Yes, we can see the palate. For that, you have to complete your class of how to get a fetal face, and there you will come to know how to take the palate also. Now, the last question from Dr. Lopadas is that how we can what are the precautions while taking the measurements of fetal pulsations of the fetus? The precautions, now see the precautions, I will say that sometimes there is a transmission from the maternal vessels. So these transmission from the maternal vessels can confuse you with a muffled fetal heart. So if you are dealing with a bradycardia, you are thinking that this is the bradycardic fetus, maybe a 70 or a 75 beats per minute, see whether these are the transmitted pulsations what you are dealing with. So this is the precaution, and for confirmation you can see the pulsations, how much from the maternal side. If it is equal to that, so then most probably you are dealing with the transmitted muffled transmissions from the maternal side. So the last question is by approx how many weeks is molar pregnancy more than the IU pregnancy? It is about, I cannot say precisely because it depends on the molar pregnancy, whether you are dealing with a complete classical molar or the partial molar. So it depends on the type of the molar, but it is much ahead. It is almost double, if not the double of the intrauterine pregnancy. So these were all questions what we have got today, and we are conducting these types of these types of interactive sessions on regular intervals. If you will be having any question, don't hesitate to post when we will announce the session. Okay, but on again requesting you not to post the question from the chapter or from the topic which you have not even touched. Whatever you have touched or completed, I am more than happy to attempt to your explain to what the difficulties and what the queries are over there, but don't pose the question from the topics which you have not even touched. So thank you very much. God bless you. And yeah, what is this? Yes. Now, see, Dr. Mushtaq is sending a query over here in the chat box. Sir, my question was not posted. If possible, can you get answer? What is the best time to do first UAG after knowing PPT? It should be UPT. UPT is positive. Now, see, I have to prepare, I have to prepare a PPT to answer. Okay, so that is why we are requesting you to post your questions before the session so that an appropriate picture can be taken so that I can explain on the picture. So next time, please post it before the session. Even 2 hours before the session will do. But we are giving you more than 5 days. We are sending these messages in your WhatsApps to post the questions so that the appropriate PPT or the picture can be shown to you so that you will get a better explanation. So see you next time. God bless all of you. Thank you very much. And we are having a small announcement that we are conducting a CME in Gurgaon, and the dates are, and so 25th of August. So on 25th of August, we are conducting a CME, and if you want to participate in the CME, you are requested to contact our helpline number, or you can contact your RN or manager for more details. Thank you very much.